Hello, Laci.
Hi, Dr. Laci.
Dr. Laci comes to my house when I need an adjustment.
That's right. How are you feeling today?
Feeling okay. I just had acupuncture yesterday. So.
Oh, how was it?
Do you see the cupping marks?
Oh, a little bit, some hickeys right there. Sure it is.
That was a good story, though, that you just told me.
You feeling better today?
I am feeling better.
Good. Yeah, you're not doing so bad. Think you're ready for your lower back to be adjusted yet?
No.
You too scared for that?
Yeah.
Okay, it's all right.
I can't really twist.
No, it's all right. I tell you. How do you do your classes?
Because I'm not demonstrating everything. I'm just, I'm
go,
very verbal.
Go face down.
It's tricky not being able to do abdominals right now.
Oh, I bet.
It's hard, but I'm working it out.
These are cute little Uggs.
Thanks, babe.
Oh, I love them. You know what? I can adjust you without having to twist you. Because I have this nifty little thing called an activator.
Oh, yeah, you do.
I do. And it's really nifty. And it works very well. Because you need it in your lower back.
Really?
Yeah. Here.
I just feel like I've been a mess since
Yeah.
I had surgery, but doing a lot better, you know.
Yeah, good. All right, let's rub it out. Rub it out.
Have you ever videoed yourself working on somebody
No,
before?
I'm not a video. I don't like having my picture taken. That's why it took so long for me to get my picture done. And I don't like.
But at least
I don't like to hear myself talk.
with this video, at least it's not close up, and
Yeah.
it just shows people that you come into the home and
Yeah.
that you'll do whatever they need. Oh my God, that feels so good.
I have to tell you, I did acupuncture forever. I never did cupping, and I never have been cupped, so to speak.
Oh my God, it was amazing, Laci. So one of the cups that he did right
Yeah.
here, I felt something in my abdomen release.
It is amazing. Listen, I have to tell you.
Oh my gosh.
Acupuncture's good stuff. Big fan, big fan.
And I was really stressed out yesterday. So the acupuncturist felt my pulse, and he knew that I had been really stressed out.
Yeah, that's how they diagnose things. And they can look at your tongue. They can, some people, not all acupuncturists, people who are specially trained can look at your irises in your eye. They check your pulse. They look at your tongue. Sometimes the ridge of your nails on your fingernails is a big indicator of stuff.
Wow, that's so cool.
There's this other, what do I call him? He's Chinese, so he's a Chinese doctor who does like a lot of hormonal balancing and stuff. But he also knows when you've got heart issues and future really bad, like it runs in your family. He can check your whole body and find like these little red dots, even like on your hairline. It's bizarre. My friend had it, and he totally found some health issues with him, big time. And he checked my nails, and he knew that I was having something fibrous in my breast tissue.
Wow.
At the time, I was having to have a mammogram at the time, and it came up abnormal.
Wow.
And he knew right away. Like he's like, did you get a mammogram this year and have some fibrous tissue in your breast? And I was like, how did you know?
Yeah, when he felt my pulse, he's like, Elizabeth, what's wrong? I said, I've been crying all morning. I had a bad day.
Oh.
It was almost scary. I couldn't hide it.
Oh. I have this other acupuncturist that she does this technique called neuro-emotional technique, NET. It's really intense because it's, they do a lot of muscle testing. And they figure out like how your emotions and your stress are relating to what you're ill with or your pain. that kind of thing. It's pretty impressive. And once again, like you said, like your body rats you out.
Yeah.
It was really cool. I used to be kind of skeptical about that stuff, but I'm becoming, which is stupid because I'm a chiropractor, right? You'd think that I would be a lot more open than most people. But, I don't like anything that thinks it's hokey pokey and, fools people into thinking it's something that it's not. But it's real. I decided, I had this patient of mine that I referred to her who was having restless leg syndrome, which I'm skeptical. I especially don't like the medication that they prescribe for that.
Oh, no.
Because it's got horrible side effects.
Yeah.
And I told her, she lost her husband 5 years ago, and he was her very best friend. They were married like over 40 years or something. Maybe longer than that. Maybe, I think it might be 60 years, to be honest with you.
Wow.
Let's go with 60. Yes. She's in her 80s. And she was, I was getting her better with her lower back and some other back issues and all kinds of stuff, but she just kept having this restless leg and, she just kept not being able to sleep well because of it. You could just see anxiety written all over her, and she would talk a lot about her husband when we had our sessions,
Uh-huh.
She still does. I still see her. But I referred her to that acupuncturist, and I said, I think this might be really good for you because I think really your pain is coming from that emotional place.
Yeah, oh yeah.
She only had 3 treatments, or maybe 4 at the very most. No more restless leg syndrome. All gone.
Wow.
It actually went away after like the first 2. So she's doing really well. Like so well that I don't have to see her as much anymore. Darn it. Just kidding. Dang it, I do when I get people well. They don't have to see me anymore. Dang it. I guess I could go and mess something else up, but I wouldn't do that. Let's see. So I got that well. Let's see if we can mess this up so I can keep seeing you. So guess what I read yesterday? It's on my Facebook page. Did you see it?
No.
The guy who goes to his ex-girlfriend for dentistry, for a toothache.
And takes out all the teeth.
Yes, did you read that?
I heard about it this morning. Someone talked about it or something.
Yep, she removed every one of his teeth. And now she's, of course, going to, lose her license.
Oh.
There's no guy worth losing your license over. Am I right about that?
Yeah.
There's no girl, guy, or whatever, no person that's worth, any of that. I was like, oh, man. Because I've actually had ex-boyfriends come to me, that I wasn't exactly pleased with. I was like, you are gutsy to actually call me up and ask me to help you, but I will help you. But I can never see myself ever hurting someone, just because they hurt me. That's just, it's not worth it.
No, that's just gross.
Okay, turn it on your back. Isn't that wild?
That's so sad that someone would think that would make them feel better to be so nasty.
I know. And I'm sure he cheated on her or whatever, but that doesn't make it okay. Crazy stuff, I say. But then I have to blame him for being an idiot for going to his ex-girlfriend for dentistry. Especially if he did her wrong, you know what I mean? Like, how silly is that?
That's vindictive. That's horrible.
It is horrible.
But you heard about the girl, didn't someone cut off her husband's penis or something?
Yeah.
Those people are mad.
They were mad. They were really mad. I mean, I can see myself doing something vindictive, but it would be a little bit more coy than that. It would still require them to go to the emergency room, but they're not going to have anything lifelong issues with it. I say, glue their penis to their stomach.
Okay, seriously. This conversation needs to never happen.
I would never do that. But you can think it. You can think it all you want, right?
No.
Yes, you can.
Those thoughts are very unhealthy.
You're right. Dang it, why can't I think horrible? But I'm one of those people who's...
Those thoughts only hurt yourself, you know.
You know, I've had those thoughts, like similar thoughts of what you can do to get back at someone. But I've never, like, followed through on them. Ever. Like, ever.
No.
Because what you do is you start thinking about it and you're like, it's just not worth that. And you just gotta let karma take over and let everything work itself out on its own. And since I'm a person of faith, I believe that it all takes care of itself in the end.
Yeah.
And you're right, like you said, it eats you up inside. So how's Max? Is he recovering nicely and doing really well?
Max is doing great.
You guys all sound better. You don't sound as nasally and stuffy.
I know, we've all been through a lot. Like,
in the last
we have. Actually, we've been through a lot.
You have.
And now that we're all feeling good, I haven't actually seen Max today because I left before he woke up to go work. That feels good.
Good.
I can't really do that by myself right now because of my abdominal.
I'll do it for you.
But yeah, that feels good. Even in the yoga class I taught today,
I'm just amazed that you're able to do this. Like, if you did this to me, I'd be like,
I don't think you would have any problem if I worked on you.
I need to come in and do yoga classes. How many times have I said that?
Yeah, you know,
100.
I think it's because it's too far for you to drive.
It's hard.
That's why you've never been there.
Well, it's just because it's hard to drive on a Friday.
What we should do eventually is when I'm teaching on the west side, work out so that you come do adjustments after class. How cool would that be?
Very cool.
I mean, there's nothing like enjoying your practice and then getting an adjustment.
Yes. All right. Now your hip is doing better. I bet your abdominal had a lot to do. You know, like that hernia thing, everything just being all drawn.
Oh my gosh, you're right. My hip is feeling better.
Like, did you see how loose it was? Just like,
Yes.
I think your abdominal had a lot to do with that whole issue we were having.
Oh my God, that's so true.
I would have never have thought that before, but now it all makes sense.
But my acupuncturist has said the same thing. He said this was so locked up.
Well, your the psoas muscles. You know these muscles right here.
Mm-hmm.
Of course, they're all connected to your hip.
Mm-hmm.
It all makes sense.
Oh my God, I talked to a girl today in my yoga class who said that her best friend was 2 weeks postpartum, had a cesarean, and was practicing power yoga. I said, have her call me today. Tell her no power yoga. Give it at least 8 weeks.
So that she doesn't get the hernia thing that happened to you?
Yeah, and I wasn't doing yoga. I was taking care of myself. You know, after a major abdominal surgery, you have to lay off abs.
Yeah.
Oh, she told me, oh no, this is her second cesarean, so she's healing extra fast. I was like, no.
No, I don't think so.
Let me list the problems that can happen. Bad deal.
It's a bad deal.
That feels good.
Yeah, your hip is much looser.
That one wanted to pop actually, but
Well, let's see if we can get it from here. Nope. This one's not going to let go as much.
hey, Dr. Laci, we're going to blast this video all over Facebook. And we're going to tell everyone to come call you that you'll come to their home or office.
And we'll talk about things we see all over Facebook.
And we'll talk about mean stories.
Mean stories, mean-spirited people. And how lucky we are that we're not like that. We're lucky. I'm not saying that I've never been that way, because I have, but you know what? You learn from it, and you learn that it's just not worth it.
Oh, after you came the last time, since I hadn't seen you for a long time, I felt like I was flying high.
It happens.
Like, it felt so good because I knew I was, like, way overdue.
I did this to a friend of mine who hasn't had an adjustment. I don't even know if she's ever had one, to be honest with you. And she needed it, so she's a mom. Same thing, and works all the time. Works hard all the time. And after I got through adjusting her, she literally was like, I'm not lying to you, I'm high. Like, I'm literally high. I'm just gonna lay here and enjoy this non-drug induced high that I've got. Because it is
You
wonderful.
know what? For me, I probably did have drugs coming out of my body because I had just had anesthesia 2 weeks before.
You might have.
So
You might have been experiencing a little high, but she wasn't like that. But hers was seriously just all blood flow, nerve flow was just all flowing. And just, so awesome. It's so good. That's why I know that I need to do yoga. I did a nice ab class last night. It's so funny that this friend of mine who's a trainer, it's 30-minute abs, and he goes, that's just too much. That's too much. And I'm like, not for these abs. Not for this discount double check. he goes, no, 15 minutes is plenty. That you're not going to even get any more results than if you would have just done 15. I'll go, look, the 30-minute ab class, I go, of course, the whole 30 minutes, I can't do everything she's asking me to do the full 30 minutes. Like, I take my breaks and do what I can do. I'm certainly not going to strain my abdominals.
you're so healthy. You're fine.
But I was
For
like,
me,
I feel it today though. I like it that I'm feeling my abs today. Like, I like feeling sore.
I do too. I like to feel that.
Especially my abs. That's a good place to feel
I'm
sore.
sad that I can't do abs right now. Since I just had abdominal surgery, how long do you think before I could do abs? To me, I'm thinking.
I'm a 4 to 8 weeker as far as that.
Oh, my doctor said definitely like
Longer than that.
8 weeks.
Longer than 8 weeks. I would minimum 8 weeks.
But it's different for everyone. Maybe because
Depends on.
because I had the baby and everything, he probably wants me to go extra easy.
And you're really healthy.
And I always recommend that for all my postpartum moms that come into yoga anyway.
You get regular chiropractic care. You get regular exercise.
Yeah.
You eat healthy. Unlike other people. Unlike other people, you're going to heal faster than most.
Yeah, I feel like I'm healing really fast.
When people take good care of themselves, don't smoke. Oh, that's my phone.
Thank you.
Stuff like that, they heal much faster.
It's nice to have you on my team, and thank you, Dr. Laci, for coming over. We'll have to show that video.
Please do.
So maybe you can have a chiropractor come to your house as well. This was a nice adjustment today because normally my baby is climbing up on the table with me, but today it was just Dr. Laci and me. Have a great day.